Tonight we're joining you from the African American Monument at the South Carolina State Capitol as a part of the Southerners for Medicaid Expansion Candlelight Vigil. We're taking part in the Southern Solidarity Action because we're fighting for health care, not jails. We know that too many people in our state find themselves in jails and incarcerated in prison for mental health and substance abuse issues, which they can't address because they don't have access to health care. We also know that many are now incarcerated and put in danger during this pandemic, facing life-threatening illness. We are glad to join this effort.
The United States has the highest incarceration rate in the world. We make up 5% of the world population, but incarcerate 25% of the people who are incarcerated around the world.
On any given day, nearly 1/5 of the inmates in the Miami-Dade County Jail are people with mental illness and who are in need of psychiatric medication. We're filling our jails with people who really have mental illnesses and are likely there inappropriately because they don't have access to the mental health treatment that they need. The Miami-Dade County Jail is currently serving as the largest psychiatric facility in the state of Florida.
I'm an industrial electrician. I have a spine disease called spinal stenosis. And
when I lost my insurance and I didn't have no means to get my medication, I then resorted to illegal activities such as stealing, selling them, and it ended up putting me in the court system, prison, and it's like an ongoing thing trying to get out of the system.
So our jails and our prisons are becoming our default mental health care system, which if anyone who knows anything about jails and prisons knows how horrifying that is and how inappropriate that is, particularly, always, but especially so in this moment where COVID is ravaging our jails and prisons and we need to be deinstitutionalizing people.
This is a call to action in this moment that we cannot deny. And the intersectionality of healthcare, poverty, and a racist and criminal justice system, to understand the need for mental health care, for substance abuse recovery programs. We have to understand that there is such a huge need to treat untreated trauma in Black and Brown communities. We understand that divesting from law enforcement is one way that we can invest in people. Healthcare is a way that we can invest in people. Medicaid expansion is a way we can invest in people. And when we invest in people and divest from carceral systems, the result is we have healthier and safer communities.